right, hi there everyone. Welcome to today's Speakers Bureau conversation, coming to you from the University of North Texas Health Science Center at Fort Worth. My name is Noah Drew and I'm going to be today's host. As you may know, the Health Science Center was involved with several projects that positioned our expertise and capacity towards meeting the community's very real and emergent needs for care and information this spring as the coronavirus pandemic was getting started here and spreading within our community. The topic today is going to explore the inner workings of one of those initiatives, which was our COVID-19 test site. Before, just as a matter of housekeeping, I do want to mention that we are recording today's session and we'll be sending out the recording to everyone who registered. So don't focus on taking notes, just soak it all in and you'll be able to reference this later if you really need to. And then we also have time reserved at the end of our conversation for any questions that you might have. There is a chat feature here on the platform. And so if you have any questions, feel free to type them into the box and we will address them as we can at the end. I want to introduce our guest hosts who are joining me today. And no order in particular, we have Ms. Vicki Cannon. She is a registered nurse and is the executive director of our clinical services here at the Health Science Center. We have Dr. Jeff Beeson, who is our Vice Provost for Academic Partnerships and Initiatives, Dr. Jeff Mott, who's an assistant professor in our Physician Studies program. And then we also are being joined by three of our students here at the Health Science Center, Ms. Anna Claire Cook, Catherine Daniel, and Hannah Marvin. Folks, welcome on today.
Good to be here.
So jumping right in with our first question, I would love to know, how did the idea or the plan for the testing site originate? Where did that come from?
So I'll take that one, Noah. Most things arise, it came from the community. So the relationship with the Health Science Center has with both the city and the county. The President Williams identified a need and also an opportunity for us to help the community. And so it was identified early on. Testing was a great limitation in our region. Dallas is starting testing, had some complications, or I shouldn't say just challenges. And so there was an opportunity and need for our public safety providers, our partners from the county, from the city, fire departments, police departments, and then our partnership that we had ongoing with Quest Diagnostics, who had the ability to do the test. So it was kind of putting all the pieces of the puzzle together. So that's kind of how the need was arisen, and we stepped up and was able to help. We were able to help the community.
Great, thank you. This was a large undertaking, to say the least. What kind of things had to come together to make the testing site happen and be fully operational on the first day?
So really, in order to make it all kind of come to fruition, we as a leadership team all met together, and we did this for several hours over a few days, and we kind of put all the plans in motion. Within a week, we were able to get the site up and running. But, you know, first and foremost, I think that the biggest thing that we had to do was take into consideration where we would hold the site. And we had to think about safety and the ease of traffic flow, and then the volume of cars that we would have coming through there, and how to keep everyone safe in there. And then the next thing, I think Dr. Beeson was great at managing for us, was identifying our roles and responsibilities. And of those roles, we had the commander, who happened to be Dr. Beeson. He was the leader of our team. Then we had our logistics manager, who took care of our supplies and costs throughout the 12 weeks we were at the site. We had clinical operations. I kind of oversaw that, where we managed the schedules, the lab supplies, specimen pickup, computers, that sort of thing. And then we also had some of our team from HSC Health that came over and worked in that operations area, where they helped print the labels and the requisitions and stuff. So that was part of it. Safety team, and they oversaw our donning and doffing of PPE, traffic control, and then in the surrounding area, we also they monitored all of that for us. And we had someone in plans who worked on process improvement and development throughout. And then also they ensured our workflows and made sure that there was food and water for all the people that were there, our volunteers and our students and everyone. And they did a really good job because, you know, we've joked and said that, you know, the freshman 15, well, this happened to be truly the COVID-19. We've all experienced a little bit of that throughout this. But then the last part of that I wanted to add was that our students took a really big role in what happened at this testing site. They did everything from our Alpha, where the cars pulled in and they identified the patients, to going to the next location, which was Bravo, where they gave them instructions, and then they went on to Delta, where we actually swabbed them in their car, and then they monitored them as they left so that they could keep everyone safe. The students learned how to don and doff their PPE. They taught others how to do that. They took over our warm area, where they took the specimen from the collector, and you know, they kept everyone safe in that region. And they also learned safe practices when they were doing all of this, because it was part of, what do I do when I'm in that situation? They learned the role of the safety person. They monitored others to make sure everyone was staying safe. And then they performed skills checkoff on mannequins and in person, essentially taking over the role of the tester from all of us so that we didn't have to do that. But one of the things I wanted to say in the end of this, I'm sure Dr. Beeson wants to add more, but we collaborated with many Fort Worth organizations. There's so many that we can't even bring them all up. But, you know, without their help, we wouldn't have been able to successfully swab over 5,000 first responders and healthcare workers in the 12 weeks we were there.
That's incredible. Dr. Beeson, do you want to add on to anything that she said?
So I just simply, to simplify, I mean, Vicki went into great detail, but we followed the National Incident Management System, incident command structure. So, you know, I'm an emergency physician by training with a lot of disaster experience. So we approached it like that. So the roles that Vicki mentioned out is in the incident command structure, which then allows span of control and understanding so that we could have all of those simultaneous tasks going on that Vicki was talking about. That sounds very confusing, but it was very simplified and easy to document and know who fit where.
That's great. And that was a really wonderful explanation of all of the infrastructure that had to be put into place. And I can't imagine doing all of that in a week. It seems like so much. So really wonderful job. What about in terms of your processes? Were those pretty static along the way, or did you find yourselves having to adapt and change as you were operating the test site?
I'll go ahead and take that. The word consistent really jumps out at me in that question, because the only thing that was consistent throughout was the inconsistency, because things changed on a daily basis. There was no template to go by. There's a big, you know, national template like Dr. Beeson was saying, but when you put boots on the ground, you get a bunch of people together, there was no template because this had never been done. So the procedures on how we went about doing things changed and were constantly improved on a daily basis based on the recommendations of the faculty on site and student input. Student input was huge with little recommendation. Each day there were lessons learned and improvements that were made in the flow, increase in communication. You know, we had radios, we'd make new signs for each Alpha, Bravo, Charlie, and so forth. We decided we needed safety vests, walking in front of cars, and these are all determined on a daily basis. As the temperature increased, it got warm, we needed sunshades, pop-up tents, more water, like Vicki mentioned. It was an ongoing process. And the more we were swabbing and having them come through one lane and then two lanes, we had to move things around. We're multiple patients that were swabbing in the car, where we want them positioned. And then we communicate that too when the people signed up. We're giving information to the patients on where we wanted them sitting in the car, and if there were a bunch, you know, do they need more than one car or whatnot, or the fact that they actually had to be in a car, they're not allowed to walk up. These things came up as we went on. So fortunately, you're asking as time went on, when we went to set up the second site, we had a template from the lessons learned from the May Street location. So when we went to set up the MLK site, which is where I got a lot more involved, we had a template to go by, and that was instrumental. You know, we hit the ground running at the MLK site with those lessons learned. along with using the seasoned students, the students that had been volunteering a lot, logging a lot of hours at the May Street site. We used them initially at the MLK site because they had so much experience and we didn't really have to tell them what to do. They knew what to do. And the faculty just kind of sat back and supervised.
Well, how nice to take a seasoned team to the second site when you opened up, something that truly didn't exist a month beforehand. We were clearly objectively successful with what we did, but to say we did it's not a very exciting story. Let's talk about some of the challenges that you faced before the launch and throughout the operation. What were some of the things that you dealt with that were sort of curveballs throughout the operations?
So some of the biggest challenges I think that we had, really, I mentioned it earlier, but safety was one of the biggest challenges, making sure that we kept everyone safe every day, not only from the aspect of cars coming through and protecting people from being run over, but also to making sure that they didn't become dehydrated in the heat when it was so difficult out there, and being dressed fully in PPE to stand out there for 4 hours at a time was difficult, I must say. So that was probably one of the biggest challenges that we had. But then also ensuring that we had enough PPE, because as you know, we've been on a worldwide shortage for a long time. And we took in donations. And so somebody had to manage to get those so that we had enough at the site. And that was a challenge. Training was a big deal because we had lots of volunteers. They rotated students in and out routinely. So it took a dedicated team to be able to train people on a regular basis. Those things, the heat, I mentioned the heat, that was really rough. And also the cold. Believe it or not, when all this started in March, it was still chilly and there were days that it was really cold. And so we tried to balance all of that. And those were some similar challenges. The other thing Dr. Beeson will mention, I know he's going to bring it up, we should talk about results and what happened with that. So go ahead, Dr. Beeson.
Yeah, I think, those who worked the site and the patients saw the front end, the actual collection of the sample. But the back end pieces were probably the harder challenge. Results, the timing of results was a challenge. Folks want to know right away, but unfortunately, it takes 24 to 48 hours and sometimes longer. And then getting those results, because most of these individuals were not patients in our clinical practice. And so trying to get the results to them and help guiding those who receive positive results, a lot of fear and education. And then of course, the mandatory reporting of this to both state and local health departments. And they were obviously very strapped and challenged with their availability of folks. And I know that, Noah, your team helped out in another role of that also. But then the source tracing pieces that we ended up helping with them, it was, just a whole nother back end procedure. So people that are doing this, don't think that the collection piece is over and done. There's a whole nother piece to it that's not really recognized. It is probably the more personal and challenging piece of the entire process.
So you referenced a lot of players. Let's get into that a little bit more. So who all was involved with the operation of the testing site? And was everyone necessarily involved the entire time, or did people come and go? What did that look like?
I'll go ahead and jump in on that. I joined after things had been set up for about a week. I went over to check it out and I could see that, Vicki Cannon and John Sims were the primary folks in the hot zone that were doing the swabbing, and they were getting smoked. It was starting to get warm and they were out there sweating away. And I said, hey, let me jump in and, and swab. So initially I was only swabbing, but as time went on, we trained up enough students, like Vicki mentioned earlier, where they were jumping in and swabbing as well. And then I became more involved later on as the commander at the second site, at the MLK site, in which I wasn't allowed to swab because you can't be the commander and be swabbing because you might go down. And like we mentioned earlier, the heat, there were several folks that were in PPE out there in the heat that had to tap out, and they were gonna, they had to doff and walk away, go drink some water, and somebody else, a backup person, had to stand in because it got hot. But yeah, did Kat and Hannah?
Yeah.
Hannah, you want to chime in?
Yeah, I can go ahead and jump in. So as far as volunteers go, on day one, there was 10 of us. and from all different schools, from TCOM, PA, pharmacy, and School of Public Health. By the end, we'd had over 300 volunteers rotating on a daily basis, shift by shift. We'd had new people coming up until the very last day. And we were really lucky that everybody came ready to go and ready to learn. We split up every shift with half experienced people and half new, so that way we would have seasoned volunteers able to guide our new volunteers and keep the process going. And then at MLK, as we mentioned earlier, was originally only experienced volunteers, but towards the end, we wanted to open up that opportunity so that way everybody who wanted to volunteer could. And we were really lucky that we got over 300 people.
That's incredible that so many students were involved. From a student's perspective, what kind of lessons did you all learn along the way?
I guess I can take this. So I think the biggest one, being flexible. I know everybody's talked about how much our process has changed over time. So that was a really big one that's, you can take with you wherever you go. Like Kat had mentioned, it was like a lot of interprofessional work. So working with students from different programs was kind of a really nice thing because, at the end of the day, everyone's working towards the same goal. Lots and lots and lots of communication. As everything kind of grew with how many clients or people we were able to see, how many sites we had, you add more volunteers, you add more positions as you kind of realize what the need is. So it becomes like kind of a trickle down effect. So lots of teaching each other, passing it on. But yeah, so just lots of good stuff that came from this.
So Dr. Mott, I wonder from a educator's perspective, how do you think this experience is going to have benefited our students in the long run?
Well, they were learning the entire time, just like they were, as if they were through a general surgery rotation or an inpatient rotation, clinical rotations, the donning, the doffing, the contamination, cross-contamination. They initially watched us. They had, the medical professionals, Doc Beeson and Chasse and Vicky, John Sims and myself. Jessica Rangel also was one of the RNs that were out there. They had all of us showing them, doing the watch one, do one, teach one initially. So it was a learning experience, not much different than it would be from a clinical perspective, as if they were on a clinical rotation treating patients in a different environment. But as we all know, there was none of us, with all of our years of experience, licensed providers have ever been through a pandemic. And so there was no template, but you get down to the basics, like Dr. Beeson said earlier, the federal level, the way the plans are set up, boots on the ground, it's the same stuff. It's donning, doffing, cross-contamination, and patient care. It's just it's in an austere environment, especially the MLK site. We didn't have a air-conditioned building over there. We were outside for most of the time. But overall, it's just a learning experience as it would be, just like any of the other clinical rotations.
Great perspective. Directing right back to the students again, Hannah, Catherine, Anna, what do you think the most rewarding part of being involved in the testing site was for the three of you?
I think just overall, the most rewarding thing was definitely getting to serve our community. Just knowing that our faculty and our students in our school were so willing and able to literally volunteer thousands of hours to take care of our community was just so amazing and rewarding. And then on the other side of that, as students, being a part of an incident command center, which is something we typically, learn on our FEMA modules once a year, but like actually putting that to use was just, I don't think we know exactly how rewarding that is yet, but it was a really amazing experience.
Catherine, Anna, anything to add?
Sure. No, I agree with everything that Hannah said. It's, I don't know. It's nice to know that I'm with a school that cares so much because, that's something that I believe in as well. But it's like a really bad time to be a medical student, but also like a really cool time because it's, I don't know, you just learn a lot and learn by doing, like Hannah was saying, in a way that you just can't learn purely from books, purely from reading. So a really cool experience.
Yeah, and I would second all of that. This is something we could never get from a textbook. Even working in clinics, I don't think we would ever have understood or gotten this experience that we'll definitely take with us into residency and into the rest of our careers. And on another level, it was just great to get to work with all the other schools and the interprofessional and get to see really what everybody has to offer and the difference of perspectives, and really what we'll see going into the future as actual medical professionals.
Yeah, I think it was an unfortunate confluence of everything that prepared you to see interdisciplinary medical care in real time. And I think you were absolutely all in the right place at the right time for the skills and the needs that we had. So it's how great is that? After having been a part of a COVID testing site, what do you currently feel or think about the state of COVID-19 testing that's currently being implemented? And this might get you a little out there, but how do you think that we've changed either for the better or not based on how we started this and where we are now?
I think for me, the first word that comes to mind is sympathy. I think we were in a really lucky environment that we were being educated on why and how we were doing the processes and why we wear the PPE and, you know, how to don and doff correctly. And, you know, I think a lot of the places that are opening the sites maybe aren't getting that education. And so I just think we were really lucky to have that educational experience a part of it. And so, you know, you hear how things have gone wrong at testing sites. And of course, anger is like a first emotion for a lot of people. But in my mind, I'm like, well, it's really hard. You don't know how many people have to get it right for your sample to get into your bag and for them to call your phone number to give you your results. So I think just overall, I just know how hard it is. And I feel for everybody who's doing it around the country.
Yeah, for sure. I think that's a great perspective. And I think we can all be a little more empathetic for having kind of lived through that. So Dr. Beeson, Dr. Mott, I'll direct this to the two of you. How did you keep everyone safe? We've heard about all the moving parts and about all of the different processes, but how'd you keep everyone safe? And what do you think maybe made your sites unique in that aspect?
So in the incident command structure, Noah, there is a safety officer. And, you know, fortunately, the Health Science Center is the home for the Texas Patient Safety Institute, Safer Care Texas. And so we had the former director actually, and the current director, both John Sims and Jessica Rangel, who were there, who served in that role. For me, in the public safety realm, this was a hazardous materials incident, right? And so the virus you're testing for is, you know, highly contagious and has clinical implications. And so you treat it just like you're dealing with a hazardous material. And so you need to make sure that people who are going to be around the virus or potentially around the virus. So you don't know of when you're testing, you don't know who has the virus and who doesn't have the virus. Everybody had symptoms of the virus because then we were only testing people who had symptoms. But that's what we went in, and we started that on day one when we started setting up the processes, and Jeff can talk about when they went to the second site. But the safety officer, what it is and remains the most important individuals the students were talking about, because you're not aware of your surroundings often if you're testing, if you had a breach in your PPE, or maybe you touched something you didn't realize you touched. And so you have to have that safety officer who's not actively participating in the tasks, but is looking out for the welfare of everybody else. In addition to the things both Dr. Mott and Vicki talked about, the environment. So ensuring that people getting rest breaks, getting hydration, getting food, because, you know, the safety officer is not just the testing, the safety officer is over the whole incident.
Yeah, I want to expand on that. And like Dr. Beeson said, we had the luxury of having Safer Care Texas as part of our team. That's John Sims and Jessica Rangel are both registered nurses. And they started off as safety, and then they trained the trainer, they trained the students to step in as safety. So it wasn't just everything Dr. Beeson mentioned. Of course, there's all the COVID and virus, but there's lining up the cones so there's enough room for the cars to get through, and not walking in front of the cars, every aspect of safety. And so we had our safety officers from Safer Care Texas walking around constantly if there was anybody on the site, even before the patient showed up, what kind of safety issues we have. We had police on site every day when we were swabbing, and we would position them, have them position themselves so that they could watch over in case any emotions got hot, which they did at times. And then, they were in position to look out for the safety of our students. But that was the biggest aspect. It was, safety was forefront always. We would stop. If something was safe, we'd say, stop doing what you're doing. You just touched your face or you touched something. We need to, hand sanitizer or spray you down with alcohol or whatever the case may be. But safety was forefront for everything.
Wonderful. Thanks for sharing. And I too count Safer Care Texas amongst my blessings. We have some questions from the audience now, and I'd like to kind of get into those, and they've been sent directly to us. These are for anyone on the panel, and I don't know is a good answer if that's true. For the layperson, can you tell us what don and doff means?
Putting on, taking off.
In that order, respectively?
So when you think about personal protective equipment, like I mentioned in the hazardous materials, right? You have a clean side and a dirty side. So you're on the clean side as the healthcare provider or the person on the inside. And the assumption is everything on the outside is dirty. So donning it, making sure you're putting it on appropriately. So the safety officer's role to make sure that there's no holes have uncovered, either you've tore your PPE or simply you think about where your gloves and your gown match, right? So making sure that there's not a gap with exposed skin. So donning it's very appropriately, putting it on correctly the first time. And then the second piece is doffing it. So, there's a very organized way of getting out of all that stuff. It's not just taking it off. You literally have to take it off inside out. And then many times you need a second person to help. So that you don't touch, dirty, clean, and then contaminate yourself in that realm. So donning is putting on, doffing is taking off.
Thank you. Let's see, another question that came through is, how does the heat affect nasal samples? That's what I get for reading. Does heat impact nasal samples?
Well, nobody jumping in, so I guess I'll jump. I see Vicky smiling over there. So it does we were doing a biological test looking for genetic debris.
Oh no. So Dr. Beeson's frozen on my screen. I'm assuming it's the same for everyone else. Vicky, are you able to read his mind and guess what he was going to say, or perhaps Dr. Mott?
I think he was going in the direction of yes, but Quest showed up. Quest was awesome. They were doing our lab. They would work on our schedule, and they would show up with a cooler with blue ice in there. I believe it was blue ice, and each sample came out, went into the bag, zipped, went straight into the cooler, and then we'd clean up our hands with hand sanitizer. So it was a non-issue because we had the coolers, and then Quest would show up and pick up the coolers and take them away. So the swabs were going directly into refrigeration, and there was no chance of them being exposed to the sun for too long. But absolutely, it's been shown that sun and heat will kill the samples. And I'm not a lab tech, so I don't know if they're going off dead samples if they can determine or not. But it was a non-issue because it all went straight into refrigeration on site.
Okay, great. That's good to know. Thank you for that. I have another question here, which is asking for the panel to address false positives and false negatives. Is there any information that you're able to share about the prevalence of either of those?
Well, I can tell you that those of us that were swabbing were getting good samples because we weren't allowing the patients to test themselves. The swab needs to go back pretty deep, and most patients aren't willing to do that themselves. So we were getting pretty good samples. We had a little nickname for ourselves called the BBTs, the brain biopsy technicians, because we're putting that thing back in to the point where you think you pull out some gray matter. But so that was a non-issue. I think Dr. Beeson, because he got the results back, would probably be able to speak better on what the positives and negatives were. I know for a while there, for the first month, I think Dr. Chasse said we were sitting at about 6% positives. I'm sure it's gone up, in DFW area since then. But when we were actively going, it was about 6%. And as far as false negatives, false positives, I can't really speak for it.
I would agree. I'm not sure that you can even say that we know for sure that we had false negatives or false positives. We did have a lot of either or. There were some inconsistencies, but that was very rarely that we had some of that. But for the most part, it was pretty dead on. Either they were positive or they were negative.
Mm-hmm.
Okay, and that makes a lot of sense. Thanks for addressing that. And I think I remember a lot of talk about just how thorough you had to be when taking samples, and how it was going to be hard to imagine civilians or patients to take their own accurate sample or get a sample from themselves. So thanks for that. This is a question that's directed right at the students. So Anna, Catherine, Hannah, can you speak a little bit about the pandemic emergency response micro-credential during this experience?
Sure, I can go ahead and start talking about that. With towards the end, we had all learned so much, and been able to gather from all of these wonderful people we were working with, the ability, So essentially the micro-credential was signaling that we as students could basically start a testing site from the ground up and run it and staff it and know where to go and how to keep everybody safe while still accomplishing the goal of testing. It's a set of online modules that, as what combined with check off in person, where we either did swabbing or we were checked off on simulated swab, as well as sterile technique and safety, and making sure with the donning and doffing, like we discussed earlier, the doffing can be the most critical part of testing, making sure that you aren't contaminating hot to warm to cold. And so we'd have our safety officer, which was part of the credential, is making sure that you were competent enough to watch another person and say, stop the line. Was probably part of our COVID bingo language, would be stop the line. You see something, say something. And so that's the micro-credential.
That's great. Thank you very much. We had one last question that just came in, and it is addressing saliva tests. Is there any difference in accuracy between a saliva test and any other method of collecting a sample?
There's definitely a difference in the collection process. There are some tests that they're talking about right now where they swab the inside of the cheek, but there's also a sputum collection where they're spitting into a tube. But I don't know what the specificity is for any of that. So I don't know the accuracy and how you can, where they are engaging in that at this point.
Okay, thank you. Thanks for your perspective there. We don't have any other questions, and we have spent a great deal of time talking about the COVID test site. So I would really like to thank everyone who joined us today in the audience, and then especially thank our panel of experts. I think it's a really unique perspective to hear from faculty, staff, and especially students about how we responded during this process. It seems like it was just yesterday, and it was only a couple months ago. So thank you so much for your dedication, both during that time and then following up with us today and kind of sharing the experience. We will be coming back to you with more Speakers Bureau opportunities for learning. So we hope to see everyone again soon, and have a great day. See y'all later.
Thank you.